Thank you very much. Senator Hassan.
Well, thank you, Ranking Member Moran, and to ranking members and chairs in both chambers for this hearing. Thank you, Commander Persetich, for testifying before us today, and to add to the Congresswoman's comments for being so candid. It's really, really important. In New Hampshire, many veterans have to travel significant distances for their VA health care, as we've been talking about, and in many places there is no public transportation available. For disabled veterans or those simply without a car, this is a huge barrier to care and can lead to veterans missing appointments, among other things. As a result, many Granite State veterans turn to DAV's dedicated network of volunteer drivers who drive them to their VA health care free of charge. And Commander, I understand that you volunteered to do this driving as well, so thank you very much. The service that DAV drivers are providing is critical to veterans accessing care, and it provides a lifeline for many disabled veterans. So how can the VA better support DAV's volunteer drivers, and what could the VA do to ensure that no veteran has to worry about finding a ride to an appointment?
Thank you for that question, because I'm very passionate about that. This country is not lacking in volunteers wanting to serve the veterans by volunteering, driving, helping out in different facilities, and problems with getting volunteers processed and cleared to be able to volunteer is not coming from the federal level. National VA is very, very supportive, but we find nationwide that the lack of communication between the director encouraging the voluntary services to get these applications processed in an expedient fashion, dragging out for 3 to 6 months or longer in many cases, is just unacceptable. So I think it's going to come from, to use a secular term, we need to have some coaching going on. First from the VA to the directors saying, hey, you need to get busy with coaching your voluntary services people, and then voluntary services approaching it with the severity and the criticalness of getting those drivers cleared, because it's, like you pointed out, it's critical to getting these veterans to their medical appointments, and many times that can make the difference of life or death in many cases. Thank you for that question.
Well, thank you so much, and thank you for your service. And I will yield back and submit a couple more questions, particularly about the caregiver program, for the record. Thank you.